মানে পলাশিতে থাকে আমার মেয়ে মৌবনি, অজ্ঞান হয়ে যেত, তার হাত পা খিঁচতো, মুখ দিয়ে একটু গাজরা মতো বেরোতো। এটা কিছুক্ষণ হয়তো সেন্সলেস হয়ে যাওয়ার পর জল টল দিয়ে আবার ঠিক হয়ে যেত।
This girl, 18-year-old girl, Moubani Kormokar, she presented to me with a history of convulsion. Her uncle, she came with her uncle, who is a resident of Mumbai. Actually, her uncle called me one day over phone and told that his niece has a tumor in the brain. What I came to know on 25th July 2011, this girl had a fainting spell following a convulsion, and she remained unconscious for quite some time. And these kinds of episodes went on, and she consulted a doctor in her locality. It's Placia in Nadia. A CT scan was advised. It showed a tumor in the brain. The danger of the tumor was right on the motor area of the brain, which is controlling the movement of the opposite side of the body. It was on the left side of the motor strip, left side motor strip. It is controlling the right side movement, right hand and right leg movement, along with some involvement of speech. Now, she consulted several doctors, neurologists and neurosurgeons, and everybody said that she runs an extremely high risk of getting a total paralysis of the right side of the body after operation. Through her uncle, she got consultation from doctors in Mumbai as well, and they also said that there is a very high chance of paralysis on the right side, and she may remain paralytic for the rest of her life. When she came to me, I asked for an MRI with functional MRI and MR spectroscopy to delineate the lesion and to know the exact nature of the lesion. We planned a very new and novel technique. We wanted to keep her awake during the surgery. This is called awake craniotomy. So she will remain awake during the operation, and at each step of resecting the tumor will know that whether her movement is preserved. We were talking to the girl during the operation while we are resecting the tumor, we are removing the tumor, working on the tumor, and we are talking, telling her to count from 1 to 100, making sure that her speech is not affected. We are telling her to make fist and squeeze something. We are telling her to move her legs, so that making sure that we are not damaging any part of the normal brain. Just we wanted to resect the tumor only, and this way practically the whole tumor was removed. Only a very small part of the tumor, when we touched the tumor, she immediately said that I have problems in my right hand, so we stopped immediately, and there is a very small part of the tumor which was left behind, which will be controlled with radiation and follow-up. Now, she recovered absolutely well. She did not have any deficit. She came walking, talking, and she left hospital walking, talking, without any sort of paralysis or any sort of weakness. I asked her whether she had any problem of concentration. She is reading books, she is studying, she can understand, she is writing, and she is practically doing everything. She had a very thick, luxuriant hair, so I assured her that her hair will remain intact, and we didn't do shaving. So the thing which made her really happy, that we didn't shave her hair. And I usually do not shave shave hair, especially of women, because I feel that's a psychological shock for them.
তারপর অপারেশনের পর এখন ভালোই আছি।